Nicole,
Yeah.
nice to see you.
Nice to see you
Come on
too,
in
Judy.
and we'll have an evaluation in this room.
Sounds great.
Okay, come on in. Give you a little privacy.
Thank you.
Hi, Nicole.
Hi,
How are
Judy.
you doing today?
Well, how are you?
I thought we could meet today to discuss your clinical evaluation.
Okay.
I wanted to talk to you about how you're performing in clinical. How do you think you're doing?
I think it's going great. I really enjoy it. It's a lot of fun.
Well, we're going to discuss this a little bit more.
Okay.
Okay. I have some concerns about your performance to the point where I feel I need to give you a clinical warning today.
What?
Yes.
Are you serious?
Yes.
That's
Yes.
absurd. I'm doing great.
You're not meeting the objectives of this course.
Well, how am I supposed to know that? Like, I go to clinical, I wear my uniform, I do what I'm supposed to do, I write my soap notes, my patients all love me. I haven't had any medication errors.
But I have been giving you continuous feedback and you haven't been implementing any of that.
What do you mean? I've been trying really hard.
Well, there's a number of areas that you're showing a lot of
Like
weakness in.
what?
Let me just walk you through the areas that I think you need to be working on. First of all, your medications. I'm giving you the names of the medications to research the night before and you haven't come prepared.
Well, Judy, it really doesn't matter for two reasons, and I'll tell you why. Because one, there are drug books all over the floor, so I can look them up if I really need to. But two, these patients have been taking these drugs for years. I know what it's for.
But you don't know that about your patients.
Well, I can ask
You need to
them.
take the time to discuss the medications with your patients.
Well, alright, fine.
I've also noticed that you haven't even checked the name ban, so I'm concerned about the safety issues with passing
But
meds.
it's not like they're going to get up and walk out of the room, Judy. They're there, you know?
You still need to go through the 5 rights of medication administration.
Okay.
Do you remember yesterday when you were, it was recorded that you're supposed to be doing a finger stick blood sugar at 11?
Yeah.
I noticed that it hadn't been done.
Well, that's not a medication.
Well, it is because your patient needs insulin administration.
Well, I mean, I did it. It just,
Yes, but it was late.
what does it
And
really
has to be-
matter if it's late,
It has to
Judy?
be in relation to the meals.
I guess I didn't understand that.
Yes.
I mean, what's 30 minutes? Is the blood sugar really going to change that much in
It
30
can change
minutes?
drastically in that period of time. Or the patient may be served their meal and you haven't administered the insulin.
Okay.
Another area I've noticed that you've come in tardy a couple of days.
What's 15 minutes here or there, Judy?
It's one of the objectives that you need to be on time for clinical every day. I'm looking for consistent performance.
I really don't think that 15 minutes is a big deal, but if it's going to give me a warning, then that's fine.
I do expect to see improvement.
Okay.
And then the other area was time management. You haven't been able to manage a 2-patient assignment.
Well, there are 2 of them. It's hard.
You need to be organized. You need to determine the plan of care,
Okay.
talk to your nurses, and or assess, do your vital signs early, all of those things.
It's just so hard, you know, with 2 patients, and like the nurses are never around when you need them. You could never find the charts when you need them, and then, you know, the patients want to yap on about their grandkids, and like you're trying to take their vital signs. How am I supposed to do that? You don't want to cut them off.
I will be here to help you work through these skills.
Okay. Judy, this is coming as a really big shock to me. I didn't realize that I was doing this poorly, and I mean, I appreciate your feedback today. I just thought that I was doing really great. I mean, my patients all love me, and it's just a huge shock. And I don't want to fail clinical. I want to be a good nurse. I'm sorry if I'm frustrated. It's a huge shock. What can I do to pass?
That's an important first step, that you're just even receptive to discussing how you can improve. So we're going to set forth a remediation plan.
Okay.
We're going to look at, first of all, administering medications on time with knowledge, being organized with your 2-patient assignment.
Okay.
Lastly, Nicole, just want to make sure that you can follow through with our final point of being on time and not being tardy for clinical.
Yeah.
It's a really important part of being a professional.
Okay. I can do that. I can be on time. And I guess I'm just a little overwhelmed. I didn't realize that I was in danger of failing clinical. It's a real eye-opener, but I will try my best. I want to do better, and I want to pass.
Great, great. So that's why we're meeting today.
Yeah.
And then I'd like to meet with you in another week to go over the remediation plan to see if you're meeting these outcomes.
Okay.
And then we'll be meeting as frequently as I see necessary, or you,
Okay.
to determine if you're meeting these outcomes.
Okay.
Do you think you can follow through with this plan?
Yeah, certainly, and I appreciate your support. I will try my best, and I will, I'll be on time, and I'll work with you to manage my time better. I'll do whatever it takes to be a better nurse and to pass.
That's excellent. And just to know I'm here with you to help you through this process.
Okay.
We're both on the same page, and we both want to see you successful.
All right.
So I'll meet with you in a week then.
Okay. Thank you.